Alright, let's get straight to it. If you're dealing with temporary ED, yeah, that's erectile dysfunction, it's not the end of the world. I know it feels like a big deal, but it's more common than you think, and good news, you can treat it. The first thing you need to do? Talk to a healthcare provider. That could mean your primary care doc, a urologist, or even booking an online medical consult. Don't worry, they've heard it all before. You'll probably answer a few questions about your health, your lifestyle, maybe even some specifics about what's been going on in the bedroom. They might run some tests, blood work, physical exam, that kind of thing, to figure out what's driving the problem. Why does that matter? Because ED is usually a symptom of something else. Stress, lifestyle, medical issues, sometimes all of the above, so the treatment depends on what's causing it. Now let's talk options. Number 1, medications. You've probably heard of Viagra or Cialis, right? Those are PDE5 inhibitors. They work by boosting blood flow where you need it most. There's also sildenafil, avanafil, and vardenafil, each with their own pros and cons. And if you hate pills, there are chewable options too, like hard mints with the same active ingredients. But remember, you need a prescription for all of these, so don't go ordering sketchy stuff online. Second option, therapy. If your ED is tied to stress, anxiety, or relationship issues, talking to a therapist can honestly be a game changer. There are specialists for this: psychotherapists for mental health, sex therapists if things are more specific to your relationship. No shame in getting support. Next up, lifestyle. Sometimes it's just your habits holding you back. Cut down on the booze. Yeah, 2 drinks a day max, according to the CDC. More than that, and you're not doing yourself any favors. Exercise more. Cardio is your friend. Studies show that 40 minutes of moderate to vigorous activity 4 times a week can make a big difference. Bonus, it's great for your mental health too. And hey, if you find you can't get an erection without porn, maybe it's time to hit pause on those videos for a bit. If you smoke, quitting can have a massive impact, not just on your ED, but your overall health. Swap cigarettes for gum or patches if you need to. Losing weight, eating better, and managing stress can all move the needle too. Get enough sleep, hang with your friends, spend time outdoors, whatever helps you chill out. Bottom line, temporary ED is treatable. Take action, talk to a pro, and don't beat yourself up. You've got this.